All right, so now we're going to talk about the specialty waters, the 2.5 and the 11.5 waters, the beauty water as well. So to get into that, what I typically will do is I'll say, now, not only does this device make the best quality of drinking water, this device has the ability to make 7 types of water right from your tap. So imagine pushing a button on this unit and you're able to make a water that's 1/3 stronger than bleach, 7 times stronger than hydrogen peroxide, but it's not toxic. Imagine never having to use a chemical in your home again. How would that make you feel? And people are like, wow, that's really cool, right? Then you're going to take out the 2.5 water and you're going to have them smell it. You're going to say, smell this. This is the 2.5 water that this device creates. And they're going to be like, oh my gosh, that's water. And you're going to say, yes, you can do this if you want. 2.5 is not going to harm you, although it's not a recommended drinking water, so I wouldn't just do this for fun all the time. But it's not going to harm you. So if you show people, look, this is a water that comes from the device right from your tap, it's going to make this water, okay? So this water is used in Japan for things like diabetic ulcers that don't heal, gangrene, bed sores. They sanitize surgery equipment with it, and hospital floors. And what I would do is I would YouTube Kangen water used in Japanese hospitals. That way you can see how this water is being used, so when you go to talk about it, you have that belief within yourself of what it can actually do. And if you wanted to really look it up, it's called mycin or vetricin here in the US. That's what they use to sanitize the surgery equipment, and they use it for wound care in the vetricin area in the veterinarian hospitals. It's called vetricin. It goes for $357 per gallon. The only difference is they've stabilized it, and it's a neutral pH, so it doesn't rust equipment here in the US. So that's the 2.5. Now from there, you want to add more credibility, because most people are not going to believe you, because it is a fantastic water that you couldn't believe it comes out of this unit, right? So you're going to add the third-party validation again. You're going to show them before and after photos in this handy flip book here. So you're going to say, this is psoriasis before and after. You're going to go through eczema. This is after 2 weeks of spraying topical 2.5 water. The next water we have is acne. So this is before and this is after. The next one is MRSA, that flesh-eating bacteria that people get limbs and legs amputated over. 2.5 water has been shown to destroy MRSA, 30 to 60 seconds on contact. So it's important to know that. And there is clinical research that you can show people that information as well. And then you can also talk about the blood. Your blood's 90% water, and this is typical of the US. We are living in a state of dehydration. The red blood cells have lost the electrical charge. They're clumped up together. This indicates inflammation, infection, and disease. But when you consume the Kangen water, 12 minutes later, it goes right to the blood. It starts to hydrate the blood. So that is a great visual for you to show people. Another thing I'll bring out at this time is Dr. Parker's book. This is very important. This is how I close a lot of sales. So this book right here, you're going to step them through the book. So you can say, this is Dr. Peggy Parker. She's a biological medicine doctor. She's known for her research and her science. So she's going to talk to you through exactly how to use these different waters. So imagine, for skin conditions like acne, eczema, blisters, burns, cuts, scrapes, and wounds. Then we have diaper rash, herpes, rashes, eczema, psoriasis. A step-by-step, water by water, exactly how to use these waters on your skin. Antiperspirant, rosacea, shingles, hair care, baldness, dandruff. And you can kind of look at the audience when you're doing this, because you're going to start to see their eyebrows might light up, or they're like, wow, it can do that? Exactly. So when they do that, you're going to actually read right out of her book. Eye health. So if you notice someone's wearing glasses, you can actually pinpoint it right here. So Dr. Parker says that when you're working to improve any eye condition, you're going to follow this protocol at least twice a day and up to 10 times per day. She wants you to put 11.5 in your eyes, fresh, right? So you're going to explain that to them. You have your ears for earaches, sinus infections, and allergies. And right there, most people have allergies, so you can even talk to them a little bit more about that. Brushing your teeth. I have a story behind my brushing of my teeth with this water. My dentist owns a unit, so I usually tell my story about how I went there. He's looking in my mouth. He's like, what's going on? You don't have any bacteria. And that adds more credibility to the water because he owns one, right? Then we have acid reflux. Now, what you probably don't know is probably 30 to 50% of people have acid reflux and on medication for it. So this is something you always want to touch on. And if they don't have it, they know somebody that does. So you can say something like, do you know anybody that has acid reflux? And they'll say, yeah, my daughter has it or I have it. Say, you know what? This is what Dr. Parker says. And I read it right out of the book as though she's saying it. Taking acid blockers creates a vicious downward spiral when it comes to proper digestion. However, this issue is one of the fastest to respond to drinking high quality ionized water. And I always say high quality in that because some people don't realize there's a difference between this and the other ones online. And we kind of covered that already, but just you can highlight it there and then you can tell them, you know what, there's cheaper machines, you can go into it at that point, or you can change it for the end of your presentation. Food poisoning like E. coli and salmonella, she recommends to drink 1 cup of 2.5 water. Typically in 2 doses, you're back to normal. Then she also recommends to put good bacteria back in and follow it up with a lot of 9.5. Hydrocolon therapy, yeast infections, dryness, dialysis, urinary tract infections, nail funguses, babies and children, baby formula. Then we have your pets and your animals. So she made 3 books, 1 for you, 1 for your home, and 1 for your kitchen, okay? The reason I tell them all this is because they're like, wow, now I'm adding more value. Remember, this is a $4,000 unit that should be $100,000. So we got to add the value as if it was a $100,000 unit because I believe that's what it should cost, right? So here is those books. You can take each of them and open them up, but usually what I do is just this one alone. So after we talk about the 2.5, then we're going to go into the 11.5 water. So make sure after this you have your tomatoes ready. And you want to test the tomatoes because if you get out here, you start doing this and there's nothing coming off the tomatoes, it's really embarrassing. So make sure you've tested your tomatoes. Then we're going to make sure we talk about the 11.5. We have our oil ready as well. So you're going to tell them, say, look, when you push the 2.5, you also make another additional water called 11.5. 11.5 fresh is known as an anti-inflammatory water. So people that have inflammation and pain in their joints or back pain, neck pain, knee pain, you can soak in this water topically and see what it'll do for you. When we age this water for 3 days, that fresh 11.5 we put in this dark container now, for 3 days it sits there and it goes through a process that's able to now get stronger with age. After 3 days, it starts emulsifying oil. And when you say emulsifying oil, people don't understand what you're talking about. When I heard that, I was like, I don't even know what emulsifying oil is. So that's when you're going to show them. So you're going to say, have you ever seen oil and water mixed together? Most people are going to say, nope, they don't mix. So you know what? That's exactly what I thought 6 years ago when I started doing this. So you can say, this is sesame oil. I'm just going to show you here that 11.5 water is able to break down oil bonds. So look at this. This is our water and this is our oil. It floats to the top, right? Exactly what you'd expect. Now look at this. This is our 11.5 and look what it does. And they're shocked by this. They're like, oh my gosh, it completely emulsifies oil. And look how enthusiastic I am about that, right? You want to keep that enthusiasm your whole presentation. So look at that. It completely breaks down oil bonds. This is my laundry soap. This is my carpet cleaner. You can use this on grease stains. You can use it on windows if you have those grease stains from kids. And also, think about what they put on our food. Have you ever noticed that there's herbicides, pesticides, and fungicides on our food, but they're oil-based? So this is the time you're going to start talking about these pesticides. So just Google effects of pesticides. You want to look up what these chemicals do to the pests. Because if you do that, you'll be surprised. It actually kills them by paralyzing them. It stops their heart. So that's something that you can add in there and talk to them about why you don't want to put these chemicals in your body, what they're doing, how much toxicity they're adding to your body, and why we cannot wash them with tap water. So then from there, you're going to say, do you like tomatoes? And most people are going to say, yeah, I do. Or you could have grapes here, you could have walnuts here, or something else that you like to show. But these are working the best. So you're going to pour equal amounts of the tomatoes into the cups. And make sure you start with clean cups and make sure you don't put your hands on here because people don't like, there's a little bit of a rotten one in there. People don't like to eat it if your hands have been touching it. So just keep that in mind. So then what we're going to do, and we've got them even here, we're going to take this one and we're going to wash it with 11.5. So this is going to sit on there, usually about 5 minutes or so, but this is the demonstration purpose, so we're just going to do it a lot faster than that. And over here, we're going to wash them with just the tap water or the bottled water. So think about when you're going to the store, you're buying your food, you're bringing it home, and then you're washing it in your tap water. What chemicals are you really pulling off? They're oil-based. You want to paint that picture for them so they feel that, because that's a horrible thing. You don't want to be giving to your family and your friends when they're over at your house. So the first one you start with is just the tap water. So you're going to wash this off in tap water first. So that's typically what you're going to get off, and you think that's good, right? You think that's clean. Now this is going to be what we're going to get off of the tomatoes, and sometimes you're going to get a little bit more off. It just depends on where those tomatoes you got. But as you can see, there's a big color change there. Normally there's a little bit more color change, but these ones aren't as bad as some that I've seen. If that's the case, just use more tomatoes. And if you test it beforehand, you'll be able to know for sure those are the right ones. So now they're looking at this and they're like, oh my gosh, that's in our food? And you're like, yes. So then you can talk a little bit more about the pesticides and have them try the tomatoes. So say, if you like tomatoes, go ahead and give this a try. First, I like to have people try the bad one. And then I like to have them try the good one. The reason for that is because when you have them take the bad one second, then they have a bad flavor in their mouth. So always have them finish off with a good flavor in their mouth. So now they've got that, and they're sitting there stewing all this information. Why this happens, you're gonna have somebody that you know, they're gonna go over to the tap and they're gonna grab tap water that has chlorine. So I'm gonna teach you next on how to do the chlorine demonstration.